I like that. That would be Mr.
The real question is where are you? I gave you the name. Thank you, Paul.
I'm here, I can't say it.
Do you want us to repeat?
Yeah.
You can use the sign sheet of word. Santa coming today?
No, he was
Did you go to school?
where did I go to school? Yeah.
No.
Well, he's right.
that's the last we saw.
Well, he actually, he told me this morning, he's like, I tried to pull up my mom and the baby were helping, but he's gonna stay there longer. Yeah. They actually just this minute I saw somebody posted the job. I guess the next person to see back. Yeah, I mean, if you guys do they grew up on the far or house on local. Yeah, that's what I saw that. And education and transportation over and the others are all on local. I haven't actually been covering local news in 4 years, but I've been on the local staff. Why did it put you on the metro? Good morning. Yeah, she's coming down.
Is there a depth of situation update today?
Yeah.
Our regularly scheduled program will resume following the announcement.
Good morning, everybody. I'm Muriel Bowser. I'm the Mayor of Washington, D.C. I'm joined by members of my cabinet to provide a situational update on the district's response to COVID. We are located at the John A. Wilson Building, and I'll be available for your questions. I want to start off with the main point of today's briefing is to talk about the 4th of July this year. It will be on a Saturday, next Saturday, in fact. And we want to send a message to our residents to enjoy the 4th of July, to celebrate according to our guidance, and to do it at home. So our strong recommendation is that DC residents celebrate the 4th of July at home or near their home in small gatherings. We, of course, know that the White House has already announced its plans, and the National Park Service will conduct the fireworks to celebrate the nation's birthday. We will continue to support those activities in the way that we have traditionally, but we hope that the crowds that come in non-pandemic years won't materialize this year. So again, we will continue to urge DC residents to stay at home. And we will, as street closures and other changes to accommodate the fireworks materialize or become more concrete, we will share that information through regular channels. The district continues and will be on the 4th of July in a public health emergency. The DC Health will also provide guidance, as I've asked them to do, about ways to stay safe in family gatherings. So look to coronavirus.dc.gov for all of that information. Large gatherings are still a high-risk activity. So if you're outdoors, that's still a high-risk activity. So we want to urge people to properly social distance, to wear a mask, and to practice good hand hygiene by washing your hands or using hand sanitizer, and to avoid public transportation. It's also critical that we remember that not just on the 4th of July, but as we move through our phased reopening, that the virus has not disappeared. It is still in our community, and we have largely flattened the curve, and you can see the curve depicted here. We have not eradicated the virus. We're still reporting new cases each day. Today, we reported 31 new cases. And as long as there's no cure or no vaccine, we remain concerned about any new case report. So I said to Dr. Nesbitt, especially considered where we were at the height, 31 seems like a good number. That doesn't seem like a lot. It seems like we're doing all the right things. And that's true, except Dr. Nesbitt remains concerned about 31 new cases that are unrelated. And so we see a plateau largely, not just in DC, but in our region, and we won't be satisfied with that plateau. So we still have to contain the virus. So that means anyone who still, we want to focus and make sure everybody is focused on any symptoms that they have, how they feel, and if they feel like they were exposed to the virus, to get tested. Testing is an important tool for finding, isolating, and tracking the virus. And you can see we have been very focused on testing and testing widely, and residents getting tested in their neighborhoods and isolating if they find that they've been tested positive. And you can see how over the last 2 weeks, especially, the number of tests in the people being tested in the district has dramatically increased. In the previous 2 weeks, we've tested almost 6,000 in 1 week and over 5,300 last week. Our firehouses continue to be an incredible part of our testing mechanism in our reopening, as well as the downtown location on F Street, at Fort Totten, and also in Anacostia, and a inclement weather testing site at Nats Park. So we are thankful to everyone who has been a part of that. I also wanted to share with you a slide that represents our hospitalizations, because this is also something, obviously, that the Department of Health follows closely to make sure that if people are getting infected in our community and getting very ill from this virus, that the hospital capacity, ICU capacity, will be there for them. So we watch this closely, and we're reminded that our experience with this virus is not over. Tragically, we're also still losing residents And I'm always conflicted by having to report the numbers of lives lost, because in that I think we lose that these are real people who have real lives, who have real families, who are mourning their loss. So just remember that when we talk about over 500 people losing their lives to COVID in DC. And we take very seriously our commitment to supporting their families as well. So none of us wants to see our numbers go back up. You've asked me here, are you concerned about it as we go through reopening? And the answer is a resounding yes. We see what's happening around the country. I'm told that yesterday, in fact, was the highest number of new daily cases in the United States since our response to the pandemic began. And the highest numbers are being reported in California, Florida, and Oklahoma. So we don't want to see any rebounding cases. So and all of the things that we have done up to this point to be so careful, we have to recommit ourselves to doing those things as we slowly turn on more activity in our city. Wear a mask, keep a 6-foot distance from others, and continue to choose your activities wisely. And as I think about what that means for me, that just because something is open doesn't mean that I have to go. Just because there are going to be fireworks downtown doesn't mean I have to go. If I'm invited someplace and I can't be sure that my host is following all of safe practices, or I don't know who's going to be there, I don't have to go there either. So just keep these things in mind as activity slowly comes on in our community. So let me just close by reminding people that if you need a test, get a test. You certainly can go to your own doctor and provider for testing, but the city is supporting several sites as well. Today, you can get tested at F Street in UDC. This says Geico Nats Park, but that's not being offered today. That's an error. But our citywide sites are F Street and UDC at Bacchus today, and at the Engine 8 on C Street Southeast, Engine 10 on Florida Avenue Northeast, Engine 30 on 49th Street Northeast, and Engine 33 at 101 Atlantic Street Southeast. So that's our update for today, and we're happy to take any questions. Any questions? Yes.
I have a question for Dr. Nesbitt. You just mentioned some states that are seeing increasing cases. What separates district and the district's approach to public health from those states?
Dr. Nesbitt.
Sure. Some of the things that we've been able to observe in the public health community is the phase and pace at which reopenings have occurred. And if the reopening occurred while you were in a certain state of community spread. So we know that we still have moderate community transmission in the District of Columbia. As the mayor mentioned, we are still reporting between 30 and 40 cases. Those cases are not connected, so that causes us some concern, but we have had a slower phased reopening, and we have not allowed activities such as bars and other nightlife activities that carry a higher risk of transmission when you still have moderate community transmission in your community. So some of the states that have had accelerated or exponential growth have had a faster reopening and have had higher rates of community transmission at the time that they were reopening. And so we want to continue to be cautious. We want, as we have stated, people to protect themselves and to protect others, to wear a mask, to continue to keep 6 feet of distance from others, and to choose their activities wisely. The mayor has stated this very clearly. We want to emphasize this, that just because activities are available does not mean that you should participate in them. People should be extremely judicious in choosing their activities especially people who are part of our high-risk groups, people with chronic health conditions, people who are above the age of 65, and people who spend considerable amount of time with people who are in those high-risk groups should be also very cautious about the activities that they choose to participate in.
And Mayor Bowser, what advice would you give the leaders of those places who are experiencing some hotspots?
Oh, I don't know that I could do that, Sophie.
Okay.
Yes.
The antibody testing that you announced last week, I know now when people call to get an antibody test, they're told that there are no slots available. And one of our reporters says that the setup in Navy Yard in Canal Park, when you go up, there's nobody there and nobody is getting tested there. Is that testing going to start soon?
Well, let me first say this, that people who want the antibodies test to see, and Dr. Nesbitt will know better what the usefulness of the antibody test is. They're available if you contact your doctor and your doctor orders one. So if anybody has any concern about waiting, please check in with your doctor. I think all of the slots that we have available have been filled, and when we have more slots, we will make that announcement, but I'll ask Chris to confirm the current operation.
Thank you, ma'am. That is correct. We have scheduled out as far as we care to right now, and actually have double scheduled in there because we do have cancellations, so we made sure we had enough extra spots in there. We are testing every day but Sunday, so if folks went down there Sunday, I wouldn't doubt that they saw that there was probably no one there. But every other day we are testing.
I think Chris should stay up there because my question has to do with that. Last night I reported, by looking at your numbers, well, you have up until the 19th here that there were 5,300 tests done in that 1 week. But the numbers I looked at last night showed that on one day last week you had more than 4,000 tests done. The next day it was like 1,500, and the third day it was over 2,000 tests done just in a single days there. So your people are taking advantage and doing what the mayor says, get tested. My understanding though is that that is slowing down the results. Are you now, are you seeing further out test results, day span now, more than the 3 to 5 that people are being told?
Yes, Paul. So we started to see that huge increase of folks coming, and we had actually anticipated doing that and having more people come in. So we brought on additional laboratory capacity for us to use. It does take some time for all the processes and all of that because they are different labs to make sure that we're doing it correctly. So what we've been able to do now is shift off, I would say 2/3 of all of our testing that needs to go to a lab off of our public health lab, which has enabled us to not have that backlog or have that longer period of time that folks may have to wait to get their results. There still are folks that are in that the group that has gone through the public health lab, and there still are tests that do go there, but we are now down below their daily capacity. So our numbers should not be much longer than the 7-day window that we actually tell folks that they are. We want to get back to our 3 to 5 day window, and we are there in many cases, but there are still some that are in that backlog.
So you're saying 7 days now, because last night when I was up at Sherman Avenue, I talked to people that were getting tested. They were being told by the firefighters there 3 to 5 days.
Yeah, 3 to 5 days is where we're at right now for all the fire stations because they are no longer going to our public health lab, and they are going out to those. That's our biggest, most high volume area. So we wanted to move those on to our the laboratories that we've contracted with because they can pick up that volume for us.
So some people may see more than a 7 business days or longer right now. But if you go to a fire station, you still will get it between 3 to 5 days?
No, we're getting ourselves back down into our 3 to 5 day. We had a period of time where we were longer than the 3 to 5 day, but we're getting all of those back down to the 3 to 5 day numbers right now. Now, there are some times when things happen with testing, and that happens everywhere with your doctor's office, in the hospitals as well with us, where folks may have gotten a test and something may have happened through that process where there becomes an inconclusive. When that happens, the folks that when they leave, they get a piece of paper that tells them to call if they don't get their test within 7 days. And if they don't call, we call them if we get the inconclusive earlier than that and talk them through what had happened to the best of our knowledge. With their inconclusive, it could be they didn't get enough material on the swab, or something may have happened to the kit along the way, or something may just happen with the paperwork. That kind of stuff happens. It's very small numbers that happens in, but it does happen. And we reach out to those folks and make sure that they can get retested. Thank you.
So I'm a new face in the room. My name is Justin Hinton. I'm a reporter with WJLA.
Hi, Justin. Welcome.
Thank you. I appreciate it. I have a couple of non-COVID related questions.
Okay.
For one, a lot of protesters were happy to see the renaming of 16th to Black Lives Matter Plaza and seeing the mural out there. Yesterday, it was closed. A lot of those protesters were moved out of the way. We've seen the fencing that has gone up around the church. Why was it closed yesterday, and are there more closures expected in the future?
I'm not sure about yesterday. Maybe the day before yesterday, it was closed for cleaning.
And then yesterday, was there, because throughout the entire day, maybe around 7 o'clock or so was when it opened back up, and a lot of those protesters were held back by MPD.
We have to clean it every day. So there will be a period of time where anything that has to be moved out that's dangerous or not allowed on the public space will be cleaned out. Yes. Anything else? Yes.
Have there been compliance checks in phase 2 with businesses? And do you have any data on how that's going? If you've had any businesses that may have not been in compliance?
Anything that you know about, Chris?
No, I can talk.
Yeah.
So, Mark, as in phase 1, there are compliance checks done on a regular basis. In nearly all the cases, when businesses are not in compliance, it's usually either ABRA or in some cases MPD that go up and say, hey, you're not in compliance with this, and we usually get compliance. So I don't have the exact numbers for you, but in the vast majority of cases, when those instances are identified, the establishment will go back into compliance.
And then any chance you would like to tell us what phase 3 metrics will look like?
Sure, we'll continue to look at some of the same things we have been monitoring. One of the things, and we spoke to this prior, is that we want people to be overly cautious about looking for a level of certainty as to when we will be transitioning, or the health department will be making a recommendation to the mayor to transition into phase 3. If you recall, in the Reopen DC recommendation, we had informed the public that a phase 3 needs to be where we have sporadic cases in the District of Columbia and or clusters of cases. As I mentioned before, and as the mayor spoke to in her opening remarks, we still may only have 30 cases and have plateaued in that area, but the cases are not yet connected to each other, which means that we still have moderate community transmission. We still have quite a bit of virus that is circulating in the city, such that any activities that people are participating in poses a risk for transmission. And we run the risk of having activities where we could have, again, another increase or a second wave. Not in the same way where people talk about a second wave of infection in the fall or in the winter, but as a result of a phased reopening. Because of that, as we would have discussions about moving into phase 3, we need to see more of our cases being sporadic or connected to each other. It's difficult to predict when that would occur from a time frame perspective. So I am not in a position to advise the mayor to say our community should expect to, within 1 week, 2 weeks, 3 weeks, have that be our experience here in the District of Columbia.
Okay. I wanted to go back to Justin's question about Black Lives Matter Plaza. Is there a plan for when that street and H Street Northwest will reopen to cars? And do you have a plan to address the tensions that have been rising between police and protesters there? There have been arrests, there have been pepper spray used.
If H Street is not open today, H Street is imminent. It will open imminently. And we don't have a plan yet for 16th Street, but we will continue to work on that. And the second part of your question is, tell me your second part of your question again.
The tensions between police and protesters in that area in the past couple of days. There's been pepper spray used. Do you think that the police response has been appropriate? Do you have a plan to reduce those tensions going forward?
Well, we need people to be peaceful, and we need people to act lawfully. So people can protest anywhere in the District of Columbia peacefully, but we can't have our police officers assaulted. Yes.
Mayor, do you have a comment on Charles Allen's budget for the police? He wants to cut $15 million from the budget. And he also wants to retroactively put a term limit on the chief of police job. This has traditionally been the chief serves at the pleasure of the mayor. Do you have any comments on?
I haven't read Charles's report, and so I have a new policy not to comment on what they're doing until I know what they've done fully. But I can tell you that we sent them a budget that we need. Yes.
I just have two questions. How does it feel, DC used to be deemed a hot spot, so how does it feel to see it no longer be a hot spot and see the numbers plateau?
Well, it makes me feel very proud of DC residents and DC businesses who've stuck together and have followed guidance strictly. And we, quite frankly, didn't know how strictly our region would adhere to guidance issued by the health department. And I have to tell you, it looks to me that they have strictly been social distancing, wearing masks, limiting their trips, staying at home. So we are very grateful to DC residents for that. We're also anxious when we see I'm speaking for myself, when we see other places who had low numbers and then had spikes. So I think that our health experts learn more about this virus every day. What we know today is much different than what we started out knowing about the coronavirus. So I think we should all feel good that our planning and preparation, our hospital utilization, all allows us to have a slow reopening.
And then my second question, at the statehood press conference last week or whatever it was, you mentioned that because your title isn't governor, you aren't always invited to some of the governor conversations about combating coronavirus. Are there other ways a lack of statehood has affected your ability to respond to?
Well, I actually said the opposite. I said that we've had to fight to be included in those governors' conversations. And we have been included in those governors' conversations. The point that I was trying to make, maybe I didn't make it well, was that this White House has framed the corona response as the governor's response, that they'll do this, but it's really up to the governors. Well, there is no governor in Washington, D.C. There are even governors in the territories. So we are very unique in the chief executive for the district not being called a governor, even though the chief executive for the district has state-like responsibilities. So that's what I mentioned. What I also mentioned was I haven't always been a big proponent of changing the chief executive's title to governor for this reason alone, because I think that some people will think that we're just like them. And that has been my concern, but my recent experience with COVID has changed my thinking about that. We should make sure that people know that we are just like them, but we still have to continue our fight for statehood.
Is there ways that the lack of statehood has affected your ability to respond to the pandemic in the district?
I think our lack of having 2 senators has impacted our level of funding. Yes.
Mayor Bowser, can you tell us the status of the waiver applications? We saw this morning you posted the 2 from, I think it's the Wizards and DC United that had been approved. There are still several pending, and I'm wondering what is the status of those? Or have any been denied yet? And when would those people who are still pending learn
Sure. So I'm going to ask Director Rodriguez to come up and address this. And there has been a process for waivers throughout our pandemic response since we closed non-essential businesses. And that process is that some people we have encouraged to go through a waiver process. Others have reached out to us proactively. I think since we started phase 2, we've actually gotten many more organizations reaching out to us for a waiver. Typically, what happens is Director Rodriguez and his team review it. It has health input as well. And then there's some decision if this is kind of a one-off request that doesn't implicate other types of businesses, we may make a decision. Some of them are in a class, and we may want to consider changes to the whole class. So that's how we approach the waivers, and I'm going to ask Director Rodriguez to talk about what we've had come in.
Thank you, Mayor. So to your question, Mark, about the waivers, you saw that there were 2 that were posted in terms of what we approved. And I think they're really good examples of the process that the mayor and DC Health and Homeland Security have laid out, which is those applicants for waivers have to provide to us a very detailed plans on how they will adhere to public health guidelines in their facilities and to conduct certain business essential activities. Those plans go through a very rigorous and thorough review by the DC Department of Health and by emergency management. And then we talk to those applicants about changes that we need to see in order for them to continue or to restart essential business activities. So that is sort of our process that we've put in place for waiver applicants.
So can you tell me of I think there's 2 more professional, the Citibank, and I think the Nats are still pending.
Yes.
There's the 3 drive-in theaters and the 3 live music venues. Have any of those been denied?
No, they have not, Mark. They are still being reviewed by Homeland Security and by the DC Department of Health. We got a first round of plans from them, and we're reviewing those right now to make sure that everything that's in there that's written down again adheres to very strict public health guidelines.
And then I saw in one of the waivers for one of the teams that was granted, one of the requirements was that they report positive test results. Is that the same for the other team? It wasn't enumerated in the other waiver. And I'm just wondering, I guess my real question would be, have either of the teams reported any positive tests?
So to your last question first, none of the teams have reported positive cases but it is a requirement that they do report positive cases to the DC Department of Health through their portal, through their web portal.
Thank you.
And you may be referring, I don't know which one you're referring to, but also what the waiver process allows us to do, Mark, and some of the information we request helps us think about other parts of our reopening or even government operations. So some of these organizations have invested a lot of time and resources to coming up with plans that we may actually be able to apply to some part of our operation even. So we request some of this information to help inform our whole response. Yes, sir.
So can I ask about retail fireworks? There apparently the vendors who do the pop-ups were denied permits this year, but Costco is still allowed to sell fireworks. Why the denial of all the...
I need to look into that a little bit further, Mark. We had a decision in one of the agencies, and I want to be able to affirm it. So I need to get some more information from them, or it may have to be adjusted.
What is that? I mean, these guys have lost most of their season. They're complaining they have been selling since Memorial Day. There's less than 2 weeks left before July 4th. Is there a possibility that you would issue permits between now and then?
I need to get some more information from the department. And so is it possible that I adjust that decision? It is possible. I wouldn't say it was likely, but it's not I'm still reviewing it.
And then can I go back to H Street? You said clearing H Street is imminent. Does that mean clearing the travel lanes of traffic and the sidewalks and everything down there? Any encampments or setups down there, or are you just speaking about the?
We expect it to be open for traffic.
So pedestrian, the sidewalks cleared as well?
It should be open for traffic. So yes, it should be open for vehicle traffic is what I was referring to, but we always expect people to be able to walk on the sidewalk. Yes.
Just a point of clarification from earlier with the cleaning. Sorry, I hate to go back to it. But from what I understand, though, Public Works has been out there though each and every day doing some of the cleaning, and at those points in time, it hadn't been closed while they were doing some of that cleaning, from what I understand. So I guess what I'm trying to get at is what was different about yesterday.
We have to ensure the safety of our workers.
And then just any thoughts on the National Guard being activated and opinion on Lincoln Park, the statue that's up that way?
The Secretary of the Interior or the Park Police, I'm not sure which made the request. Was it Interior directly, Chris, or was it Park Service? The Park Police. The Park Police always has the ability to call up the DC National Guard. It's our understanding that they are DC National Guard. They're not out-of-state guard. It's also our understanding that they will be on federal facilities.
And any opinion on Lincoln Park, on the statue that's up that way?
This is what I think we all need to do with statues, is kind of have a reasonable conversation on statues and other references to historical figures. Not have a mob decide that they want to pull it down, and certainly not destroy anything in the district or set anything on fire. So my kind of first response to you is we need to maintain safety and order around the statues. But I think we need to have a larger conversation about it. Congresswoman Norton, as you know, has proposed a piece of legislation about the Jackson statue at Lafayette Square. And there's a lot of competing views about the Emancipation statue at Lincoln Park. So I'm getting my thinking around how we can have a discussion about that.
Is there anything that you would do or that you can do with leading that discussion as far as the local level?
Yes, it is. We're working on some ideas. Okay, thank you, everybody.
We now return to our previously scheduled program, already in progress.